Dr. Bebat here. Let's do our medical term of the day. And today I want to do rosacea. Rosacea is a skin disease that typically affects the face and typically occurs in people over the age of 30. It involves several different things and can be broken down basically into 4 different subtypes. They all involve an inflammatory response to the face. The first one is erythematotelangiectatic rosacea. This involves facial redness on the cheeks and enlarged blood vessels in the cheeks. The second type is papulopustular rosacea, and that involves pimples and pus-filled lesions on the cheeks, forehead, around the mouth, and can sometimes be called adult acne. The next one is phymatous rosacea. Phymatous rosacea involves skin thickening and can readily be seen on the nose. That's where it's most prominent. And if you know who W.C. Fields is, W.C. Fields had phymatous rosacea. The last one is ocular rosacea. It's not as obvious, but it causes redness of the eyes, irritation of the eyes, inflammation of the eyes and lids, and development of styes along the eyes. Now, there is no good test for it. You go to the doctor, you describe your symptoms, you describe what you think brings it on, and you end up with a diagnosis, basically. There's a lot of things that can trigger rosacea. Exposure to sunlight, increased stress, alcohol. Those are probably the biggest factors that are out there that do this. Some foods, spicy foods particularly. So you go to the doctor, you say, I've got this red rash on my face. It happens every time I drink alcohol. More than likely it's rosacea. Treatment. There's no cure, but there are treatments. There are oral antibiotics that can help. There's some gels and creams. There's our good friend ivermectin that can be used, as well as an antibiotic called metronidazole. Another thing that you can do is avoid what triggers it. So if you have a red rash on your face, pustules on your face, and you don't know what's causing it, it could very well be rosacea, and you need to go have it looked at